Okay, so we might be back in national lockdown, but I've got another double episode of Mental Health Monday on the way. First up, we'll be hearing from a GP, Dr Usman Sajjad, and we'll also be hearing about Merseyside Mental Health Week with the CEO, Chief Exec of Imagine Independence, Margaret Hanson.
People get used to, going outdoors, seeing their friends, going to the gym, and now everything's been stopped. I'm only going to see the mental health issues get worse. Far worse.
There's arguably a time, isn't there, to have conversations around this where you say, in a perfect world, how would we improve the mental health of workforces, of the nation, of our kids, and all that, young carers, and all of those different things. But I always kind of get a sense that that conversation's too big a conversation for anyone to want to take on.
And I know those organisations are certainly there in the third sector and the community sector. I think that the thing is, it's how you pull them together and how you enable or agree as a group of organisations to play to your strengths and not try to do everything yourself, because you get more bang for your buck that way.
And I'll be reminding you how you can make connections with mental health organisations within your community. It's Mental Health Monday.
Mental Health Monday with Mick Coyle.
Tackling the stigma.
Okay, let's get back into Mental Health Monday. Delighted to say joining us on the programme this week. Now, he's a doctor, a GP, so we can talk through about going to see your GP about mental health. We can talk about 1,001 different things in regard to mental health, as we do on Mental Health Monday. But we've also got to talk about what's it like, what's it been like for a doctor during the coronavirus. Dr Usman Sajjad joins us on the programme now. Dr Uz, pleasure to get you on the programme. Really great to have you on board. I can only imagine what things have been like for you since, well, we'll go back to March, but probably a little bit before March, in the middle of a pandemic. You'll have trained for 1,001 different things as a GP, but this must just be something else.
It was bad. I mean, I'm not going to lie to you. When we first started to hear about it in January and February, I didn't think it would, more so January, I didn't think it would sort of travel over here. You'd hear about the one or two cases. And I remember they brought patients over to Arrow Park, I can't remember what it was for, but I think, it's not going to be serious. And then it started to get quite serious from March. And then everything started to change from our perspective. We've been used to seeing patients face to face on a daily basis in the 10-minute appointments. That had quickly gone to, we now have to speak to everyone over the telephone. And there's a lot of drawbacks, a lot of limitations to speaking to someone over the telephone comparing to seeing them face to face. So we started to notice the difference there. And then, obviously the cases started to rise and people started to become more unwell. Death started to come. So, it had a huge, huge effect. And not only the virus itself, when lockdown happened initially and now it's happening again, you see the impact on what it does to, financial situations of people, mental health issues, which we're going to talk about today, and other aspects as well, people's physical health as well deteriorating. So it's really, really unfortunate. And I mean, I've never had anything like this. I'm quite a young sort of doctor. I've only been qualified I've only worked as a doctor since August 2014, but I know not a lot of people have gone through anything like this before.
I can only imagine what that experience is like in regard to the fact that you're so used to seeing somebody face to face. You're so used to those 10-minute face to face appointments, and that can be 1,001 different topics. And then obviously one topic seems to dominate. But presumably as well, you must have been thinking, well, where are those people who had a lump or a bump? Where have those people gone who've had, blood in their poo, or all those, those other things that people would call and jump into the doctors about?
Of course, yeah. And I was saying this to my colleagues, like I almost said speaking to people on the telephone is like me doing my job with my blindfolded and having my hands tied behind my back. That's what it felt like. And it almost felt like you're working abroad in some rural village. Like there's not much you can do. You give advice over the telephone, and you rightfully so. Some of the alarming symptoms that patients would feel comfortable coming to your GP surgery about, they may go undetected. They may not want to call the GP because, like you mentioned before, initially when it started, they didn't know whether the GP was open. So they don't want to come to the GP because they think they're going to get the virus, and then they don't want to call up because they'd rather be seen face to face. And then also they don't want to go if there's something serious, they don't want to go to hospital because they don't want to get the virus. So it's not just the virus, it's impacting on everything else. If they notice any blood in the stool or anything serious, that they would normally come and book an appointment. Because especially for a lot of elderly patients, going to see the GP is like a day out for them. Just going to see like a friendly face, a doctor they've been used to seeing for so many years, and then you cut that off, and a lot of people then have sort of loneliness and isolation for a couple of weeks.
We'll come back to talking about sort of where you're at and sort of where things are at the moment, because coronavirus and COVID-19, the new lockdown, of course, dominating people's lives as well. What sort of things are you seeing and hearing in regard to people's mental health at the moment? Now, we've done a lot on the programme with surveys and stats, and sometimes when you hear about the numbers, it's quite clear that there is a major issue going on out there. But, a survey is a survey, a stat is a stat, and of course you see the people, the human beings that make up those numbers. What's the anecdotal side of things that you've been seeing in regard to how people have been responding from a mental health point of view through COVID-19?
Like April and March, it is people's depression and anxiety are worsening. Getting more calls to the surgery now saying, they're noticing their depressive symptoms have worsened over the last few weeks, triggered by, stress, whether it's they've lost their job or having to be, indoors. And it's not only in adults as well, particularly children who suffer with ADHD and behavioural conditions, or even autism, for example. Parents are reporting their symptoms have worsened again, from them not being able to go and interact with their friends or doing things they were normally doing, having to be stuck in a house. So it is having detrimental effects on people's mental health as well. Again, with some of the other conditions like PTSD and, this, because people get used to, going outdoors, seeing their friends, going to the gym, and now everything's been stopped. I'm only going to see the mental health issues get worse, far worse.
Is that a real fear from yourself and your fellow colleagues as well, that the issues that you've seen so far are actually only just the tip of the iceberg as to what's to come?
Definitely, 100% the tip of the iceberg. And yes, the virus is serious, but these are now the implications of the lockdown and the virus itself, the mental health issues, and it has implications on everything else. Counselling services, because on the Wirral and in Liverpool, the access to counselling is through a self-referral system. You call up yourself or you email yourself. So obviously, if you've got 100 more people needing counselling, it puts a massive strain. There's only so many counsellors that are available, so many psychologists. So it's putting a massive strain on the resources that we have. And then due to that, a lot of people are being encouraged to use these online resources. But a lot of people don't want that online resources. People want to talk to someone, especially if their depression is just not helping and they're on the maximum dose of antidepressants. So everything is causing a massive, massive strain on resources for mental health.
If we get political shortly, for a short amount of time, if we get political on this, do you think that arguably what we're experiencing now from a mental health point of view, and what we will continue to experience, is actually exacerbated by years and years and years of chronic underfunding into those other mental health services, which, if that funding had been there and had been there for, let's say, the last 15 or 20 years, that system could pick up now where it's required. And at the moment, those systems aren't in place as we will need them in the coming weeks and months. Definitely,
100%. Definitely. It's not only the mental health funding into sort of services for the elderly as well. That's something I've always noticed. There's not a lot of resources and funding for the elderly and sort of care in the community and stuff for them, because it is a lot of the stuff is privately funded. But what about some of the elderly that live in the more deprived areas? How do they sort of cope? So yeah, it is. Without getting too political and Tories and this, that, the other, it's pretty evident that we're struggling now. We have been struggling for years. It's really hard for me to say, really hard for me to stand back and say, well, how serious are they about the NHS? How serious are the Tories about the NHS? But again, that's a totally different. So I'm not going to touch upon that.
Yeah, you can do that one on your podcast, by the way. The Dr. Us podcast. We'll save that one for another day when we've got a little bit more time to talk about that.
No,
let me ask you this then. What for you would be sort of the ideal response if somebody is saying, my depressive symptoms are worsening, the feelings of anxiety and stress that I had with the first lockdown is coming back. What's that sort of the magic bullet for you where in a perfect world you could say, right, well, I listen, I hear, I understand exactly what you're saying, and this is what we can offer you. What would be ideal there? What would be the perfect thing to do?
As in how I'd ideally manage a patient with depressive symptoms. Okay, so if
funding wasn't an issue and if there wasn't was years of underfunding, if it was in a perfect world, what would you like?
Well, I always start and I always say to the patient, what was it that you expected? What are some of your expectations? Did you have any ideas on what you'd like to do? Or, a lot of patients would have a read on the internet. A lot of patients would know a friend that have gone through the same thing. So they'll come to the GP appointment with myself with their own ideas or their own expectations. And I always say, well, what are some of your ideas? So we can always touch upon that. I often say, especially for mental health issues, for depression, yes, medication is effective. And I always say, yes, antidepressants will make the bad days not so bad, but you're only going to see a huge percentage of improvement rate is, I always say, through counseling services, either counseling or something called cognitive behavioral therapy, which is known as CBT, as you're aware. And that's basically something to help people almost retrain their brain, coping with sort of stressful events, coping with those sort of scenarios that have, bring on those symptoms. So I often say, yes, it's good to have a combination of both, the medication and the counseling services, the psychological therapy. But I often say the psychological therapy is far more, you're going to notice the effectiveness of that. In an ideal world, 1 to 2 sessions a week. If funding wasn't an issue, because a lot of people privately funded, funding wasn't an issue, counseling 1 to 2 sessions a week. As well as that, there's a lot of iPhone apps as well, which I encourage people to download. Things like Headspace, which is a good form of meditation, Calm as well. Other sort of similar iPhone apps, which when you're feeling anxious and tense, just putting it on for 15 minutes and following the instructions. The importance of exercise as well, trying to sort of, and I often say exercise doesn't have to be running a marathon or lifting weights. Exercise is specific to, it's unique to everyone. So if you enjoy going on walks, if you enjoy dancing, gardening, doing that a couple of times a week, 3 to 4 times a week, if you can do 150 minutes of moderate exercise, you're going to get good physical and mental benefits, mental health benefits. And as well as that, I often say to the patient, after this, like, who's at home, do you have a good sort of family or friend support? And often they'll be like, yeah, I've got good support from my sister or my mum or my friend. And I often say, well, how would they feel if you were to stay in contact with them a little bit more? So it's sort of initially before I managed them, I'd often try to find out about their life and sort of implement what they enjoy doing, like, because with depression, as you're essentially do not enjoy the things you used to enjoy. If you enjoyed watching boxing or going here or there, it's often trying to find that love for what you had, what made you happy. And that, so that they're the sort of core things. And of course, touching upon if they're drinking a little bit more or taking any recreational drugs as well, which is a totally separate matter. So in an ideal world, with lockdown not being here, that's how I'd sort of manage them.
That's a great response. We've got Dr. Usman Sajjad with us on the programme for Mental Health Monday this week. CBT comes up all the time, cognitive behavioural therapy. Yeah. And often it's, as you've just described there, like a learned thing that you learn how to do. Could it just be taught? Could you teach it? Could you teach it to like 13 and 14-year-olds as like a resilience tool in school? It would strike me, because it comes up so often that people use it as a weapon against mental ill health. That part of me thinks, well, if we all had that weapon, then we could revert back to it.
Yeah, no, that's a really, really good point, actually, being taught in schools. And it's about coping with stressful situations, because naturally when something bad happens to you or you have stressful, it's about how you process that. And if you don't process that event or scenario, your mind can play tricks on you, and that's when you get those symptoms of anxiety, low mood, and it's almost like a vicious cycle. Well, this has happened to me, so because of this I feel like this now, and because I feel like this I don't want to do this, and then it's just and then I don't exercise or go to work, and it's all a vicious cycle, all because of what might have happened in that patient's earlier life, or what might be happening to them that day, or a relationship or something. So CBT is something that I feel more emphasis should be put on it, whether anything in work as well, whether there's sessions in work, in people that work anywhere, whether there's a session a week or a session a month, as a team building thing, because not a lot of, yes, there's more awareness to mental health nowadays, but I think a lot of people are still quite stoic, oh, I don't need any of that CBT rubbish or this, that, and the other. But at the end of the day, I think a lot of people seem to think CBT is the same as counselling, where you're going to go sit down opposite someone. When it's totally not. It's not. At the end of the day, it's something completely different.
And I think that's more about our overall relationship, isn't it, with
our
mental health, and how just we've grown up in a society where we're all pointed in the same direction and said, this is the direction you've got to go in, and if you can't cope, then that's probably because there's something wrong with you, as opposed to saying, look, here are the skills you might need. Go on your journey and see where it takes you. And I'm sure CBT absolutely, along with many different things, mental health training, as standard, in all workplaces, absolutely, schools, colleges, and everywhere in between as well. No, I think people would absolutely agree and hear that and think, why couldn't we do that? And I think there's arguably a time, isn't there, to have conversations around this where you say, in a perfect world, how would we improve the mental health of workforces, of the nation, of our kids, and all that, young carers, and all of those different things. But I always kind of get a sense that conversation's too big a conversation for anyone to want to take on. It's almost too big. And that mental health issues affect the economy in one way, and they affect working hours another way, and the suicide rates are always sky high, and it's awful every year to read them. And yet these big conversations about how we do it don't really seem to take place, which is, I think, a real shame, because I think there's loads of ideas, and I think relatively simple ideas that would make a big difference.
Of course, of course it is. And I think with everything going on now, with a lot more celebrities, athletes talking about mental health, adverts about mental health, I think I still remember, was it 2012 when Gary Speed? And I remember it just being so sudden and no one expected it, and things like that, that make men want to talk about their problems. And I think, over the years, I'm finding a lot more males come to me and mention, I am depressed, but I often find a lot of times, and I think this is quite unfortunate, they'd often come and share it when it's a little bit too late, when a lot of things in their life have crumbled, they may have lost their job, or something might be happening in their relationship. But I often say it's, despite it looking like it might be too late, it's never ever too late to get any help. Never ever too late to get any help, and no one should ever suffer alone. And you might think you have no one in this world, but there is someone that does care about you. There is someone that does value your life, and would be devastated if something happened to you. Like, you sometimes when people are feeling low and are feeling, they think, well, no one cares about me, no one will care. But you think of what it would do to that person if you did something to yourself, So I'm just quite afraid of the impact the lockdown is going to have on people's mental health going here from there. And I really hope that they don't extend this beyond 4 weeks, and it doesn't turn into a 16-week job like last time.
And time will tell on that, and of course it throws into Christmas into the picture and all that, and what people would normally do during that time. I tell you what, Doctor, let's. I'm not going to do like a role play thing with you, but I think sometimes when people think about sort of a new idea or want to do something for the first time, they call it threshold fear, don't they? They're stepping over the boundary. What's going to happen? What's it going to be like? So you're a GP, and somebody comes in and sits in front of you, or has a Zoom call with you, or a GP chat, and they want to talk about their mental health because they're not feeling okay. They've maybe experiencing depression, or they just don't feel quite right. Can you give us a sense of what you will say and how you will respond, so that then people don't feel so wary of
good
speaking
question.
out in the first place?
So, I mean, in the first instinct, if we were seeing them face to face, often they'd come down, and a lot of them would just break into tears before they said anything. So it's a little thing. Like, I'd often lean forward, I'd get them a tissue straight away, let them cry, and I'd often say, listen, it's okay, it's okay. Listen, you've come to the right place. It's just about comforting them and building that rapport initially, and a lot of doctors are afraid to get, they stand back, they want that distance, or it's a bit awkward for a lot of them. But I'd often just lean forward and be like, listen, it's okay, not inappropriately, but just sort of like, sort of be like, listen, it's okay, it's okay. I'd give them a tissue and be like, it's okay, just try comfort them a little bit, and then it get about. But on the telephone, I'd often say, listen, thank you for coming to see me. They'd often say, listen, I've been struggling. And then I'd say, listen, you've come to the right place. You sound like you're quite upset. What's been going on, mate? And then they'd often tell me. And a good thing of being a GP is listening to the patient. So, it's often, you can get a lot of information from just listening to them, just, actively listening, like, and just letting them talk, letting them tell their story. And then when they have, that's when you can ask a little bit more about what's been going on. So how long have you been feeling like this for? How's it impacted your life? Can you remember when they all started? Was there something triggered you when it started? And then you obviously need to ask about other aspects which are important to mental health, which we always have to ask about. So you need to check if they're high risk or not. So have they tried to harm themselves or harm other people, while they've been feeling like this? Have they thought about, has there ever been a time when they've thought about ending their life? And a lot of patients, would say, oh, no, I've never thought about that. But a lot of patients would say, yeah, I've had thoughts about that. And I'd often say, well, Mr. So-and-so or Miss So-and-so, you've obviously had thoughts about that, which have been quite unfortunate. Has there been something which has stopped you at the time? And a lot of them would say, yeah, my dog, or, my kids, I could never do this to my kids, or, my friend, or something like that. And a lot of people may even get to a stage where they've written a note, or they've sent a text to someone, but something has stopped them. And we call this a protective factor. It's protected them from doing this, basically. And it's strange. You can almost tell the ones that need help, they come into the room, they'd initially, before they tell you, they'd start crying, be very upset. And then they tell you they'd be fine. And then when you ask them about suicide and what stopped them, as soon as they mention their kids or something, they'd start crying again. So it's almost quite sad and distressing seeing this sort of whirlwind of emotions there and then. So you'd often ask them, what stopped you from doing. So they'd often say, and I often say to them, listen, think about how they'd feel. They'd be devastated, your kids, or imagine your dog, who would be there to look after them. And, they'd be like, yeah, and then you also want to ask them about other mental health symptoms as well, like, making sure they haven't been hearing voices, or they haven't had symptoms suggestive of bipolar. But that's just you ruling out other things, or making sure they don't have panic attacks. And then moving on from the actual signs and symptoms themselves, I'd start asking them about their home life. Who do they live at home with? Do they have, a good sort of network of family and friends? What were their hobbies before? What did they used to enjoy doing? Like I mentioned before, do you drink alcohol? Are there any recreational drugs you take? And then I'd also, we often have the patient's notes in front of us. So I'd make sure, are they suffering from any sort of health conditions? Because a lot of times, if they suffer with conditions like osteoarthritis or, other asthma or these other conditions, the nature of that condition can be causing, the mental health issues in the patient. So, yeah, it's just about sort of taking a sort of general history, but you have to approach the situation really delicately, because you've got to think that patient, it's taken a whole lot of courage and bravery for that patient to come and share that with you. Something that's really been destroying them mentally for the last few weeks, months, or years. So I think as a good GP, it's almost about making them feel comfortable and, you know, making sure they come back to you, because you don't ever want to have that thing where they feel that they've been fobbed off or haven't been treated properly, because they're not going to come back to you, and it's going to make things even worse. And yeah.
In regard to that, when those conversations take place, I guess honesty is a really important thing there. You know, if somebody has been taking Class A drugs, for instance, or if they've not been taking medication that they should be taking, or if they have been feeling suicidal but they tried to tell you otherwise, presumably there's an element of there's got to be an honesty thing there, because what I'm saying is there's no wrong answers, I guess, when you're asking those questions, because I guess you've got to see the biggest picture possible to allow you to then make the decisions and signpost in the right direction.
Yeah, of course, yeah. And I often say to them, because you can, like I said, it's easier when it's done face to face, because you can tell someone's body language. But I'll often say, how much do you drink? And they'll be like, oh, a little bit, or I've just been drinking a little bit more. And I'll be like, how much is a little bit more? And you have to pry that information out of them. Some of them will be honest and be like, no, I don't drink alcohol, or I drink 2 glasses a week. But you have to pry that information out of them. And again, with Class A drugs as well, they will tell you, but they'll tell you in a very embarrassed manner, rightfully so. So I think those aspects are really, really important as well with medication. A lot of them will be honest and say, listen, I was taking the medication, it wasn't working, I stopped taking it. But I often say, you know, people, especially with those, you know, people who drink to drown their sorrows don't know that their sorrows can swim. So I often say, you know, we can treat your mental health issues and your depression and anxiety, but if you're still drinking huge amounts of alcohol and you're still taking Class A drugs, they're going to counteract each other. Like, you're just going to feel worse and you're not going to go anywhere. So we can help you with your alcohol and drugs, but you just need to be sort of transparent with it. And it's about trust. If you can show that you're trustworthy as a doctor and show that you've got time and patience and for them, they will naturally start to open up to you a little bit more, you know.
And when people leave after that first conversation, either leave the surgery or put the phone down, or just before they put down the phone, what sort of things do you think? How are they with you? Is there a sense of relief in their voice? Do you think? Do they leave with a bit of a spring in their step, thinking, right, that was the thing I was worrying about, or that was the conversation I was worried about, and I'm through it now?
Yeah, a lot of times, yeah. Like, if I've started them on antidepressants, I always like to, by the guidelines, you should be following them up 2 weeks after starting them on antidepressants. So I always say, listen, let's touch base in 2 weeks' time. I'll book you an appointment. You can touch base with me in 2 weeks' time. If you need to speak to me sooner, that's absolutely fine. You can book an appointment with them whenever possible. But yeah, a lot of times they will thank me, even the ones that sort of, because a lot of times with men, you know, the older men or the men with wives like myself, they will say, well, I didn't want to come in. My wife just booked the appointment for me. So I'll often try to get on their side, and I'll often be like, well, so why is she worried? You know, my wife worries all the time about me. Why is your wife worried about you? You know, try to get on their side, try buddy up to them. And then that's when they tell you, because I have had a lot of patients, you know, in some of my earlier years where, you know, they've been like, oh, I don't know why I'm here. My wife booked the appointment. And I'd just be like, well, why are you here? I'd just be like, well, why are you here? Do you want to leave? But I've started to see, it's working as a GP, it's about the psychology. You have to realize that patient has come to you at that time with a certain problem for a certain reason on this occasion. So so I often say to them, oh, why is she stressing? Why is she worried? Or it could be the other way around, you know. She might say, oh, my husband's booked this appointment. So I'll often, you know, so yeah, it's just these little sort of nuances, and it's about to, they'll often feel a sense of relief when they got off the phone, or they'll be like, thank you, I feel really better, and I feel much better having talked to you or got this off your chest. I mean, that's just me. I can't speak for other doctors, and I can't speak for, you know, how their other experiences. I mean, I'm sure there's patients that have great experiences with their doctors. I'm sure there's patients that have really bad experiences with their doctors, but you should be getting a sense of relief from the patient and satisfaction from the patient, essentially, you know, if you've explored all their concerns and expectations.
Absolutely. Doctor, taking up so much of your time. If people are thinking, you know what, I probably do need to speak to a GP, and it might not be on a mental health issue, it might be a million and one different things. What would you urge them over this period of the next 4 weeks where they're hearing we're back in lockdown, we're supposed to stay in lockdown, but someone thinks they need to see a GP? What would you say to them?
Definitely go see your GP. You can book an appointment. You can either call up the surgery before 8 in the morning to book an appointment for the same day. Some practices do pre-book couple appointments on the phone, but I'm also telling a lot of patients that if they struggle to get through on the phone and they have internet access, they can go on their GP practice website and they can go on something called, on the GP practice website, there's something called e-consult, e-consult. There you can fill out details of your problem, how long the problem has been there for. And when you have submitted that form, there is an obligation from the GP practice to, for a doctor or an advanced nurse practitioner to contact you within the next 24 to 48 hours. So you won't be, there's no face-to-face appointments. I always say to patients, if you're very unwell and you're concerned about an emergency, do not hesitate to take yourself to A&E or call 111. But in the daytime, I take yourself to A&E if it's something that's an accident or an emergency. But for regular GP appointments, we're available. We're doing telephone consultations. If we decide that we need to assess you and see you face-to-face, we can bring you into the surgery. But do not hesitate to sort of book an appointment. And like I said, there are other options. You can book it via the telephone, or you can book it online, which is via the e-consult service.
Absolutely. And I guess, time is important, isn't it? That, waiting a month could, if it's a particular problem, a month might be a little bit too long to wait,
Definitely. I often say, don't, if it's down to your health, physical and mental health, you should never ever wait and never ever hesitate and contact someone as soon as possible.
Brilliant stuff. Dr. Us, the Dr. Us podcast is available now in all good podcast stores. And you've had more than 50 episodes of that as well. And you do mental health, sport. Obviously, the stories from being a GP as well. Looking forward to hearing some more from you on that one as well. Dr. Us, that's the word doctor, and then Us, UZ, podcast. And there's also a Twitter handle, which we'll put the links on our postings for the podcast here. And Dr. Usman Sajjad, thank you for your time. Thanks for joining us on this week's Mental Health Monday.
Cheers, Mick. I appreciate it. Thank you for having me.
Dr. Us, great to get him on the programme. Right, let's continue our conversation. I figured because it was the first week into lockdown, we'd do another double bill of Mental Health Mondays. People try and get their head around where we're at and where we're going until December the 2nd. At least, potentially then some after that. Let's hear now from Margaret Hanson. Now, Margaret is the CEO of Imagine Independence, and last week they were marking their own Merseyside Mental Health Week. Loads of different things that were going on throughout the course of the week, and they've also got a wider project called Building Up Stronger, which they wanted to tell you about as well. So I thought we'll invite her on the programme. But Imagine have been around for quite some time, and I started by asking Margaret how Imagine Independence all began.
Well, Imagine started, it depends who you ask. It started sometimes in the mid-1970s by a group of concerned citizens who lived in Liverpool who believed that people who at that time were being effectively locked up for a lot of their lifetimes in big mental health hospitals around the city could actually have a better quality of life and live with meaning in the community. And so, as with all good Liverpudlians, they got a campaign going and challenged the then health authority, whichever predecessor of Merseycare it was, to let them try something different. And fair dues they did, and 40 odd years later we're still doing some of that original work. So we do support lots of people to live independent lives with meaning in the community. And now it's across Liverpool, Sefton, the city region, out into Lancashire and other parts of England, but we're very much a Liverpool grown organisation.
And that trailblazing start plays out with what you're doing at the moment. We'll talk about Building Up Stronger as part of the conversation today. Let's talk about Merseyside Mental Health Week, though. So important to, every week should be Mental Health Week, shouldn't it? But sometimes when you dedicate and designate a specific week to something, it just focuses the mind, gets a little bit of maybe media attention what you wouldn't normally get, and it allows maybe some conversations to be heard that maybe otherwise wouldn't be heard.
Well, yeah, the inspiration for the week came from listening to what the people we support were telling us about their experience of the first lockdown, where and there's evidence to back this up. And tomorrow morning at one of the events, a great guy called Andy Bell, who works as the deputy chief exec of the Centre for Mental Health down in that London, will actually be speaking at the event, because they've done an awful lot of in real time research with people with mental illness about their COVID-19 experiences. So we're looking forward to what Andy's going to tell us. But what we do know, and it's borne out by the people who we support, told us that their mental health, which was already poor before we went into lockdown because of the nature of some of the illnesses they have, just got that much worse during lockdown. So for some people, having a routine is part of keeping them well, and all of a sudden they couldn't go out. They will have developed, real meaningful relationships with their local communities, whether it's going down to the pub, going to the local corner shop, going into town, whatever. I even know that some people actually use the same buses every day and have a really good bit of crack with other passengers that they see on a daily basis. All of those things that go into making up a life that has got, some worth in it were just suddenly gone. So that was one group. And then the other group are those people who, as part of their mental illness, actually believe they have anxiety. They believe that, that great big world out there can be a dangerous place. And all of a sudden they were being confirmed in that belief. The constant bombardment from central government and from the media and just everywhere you turn was about this virus and how easy it was to catch. And so that just reconfirmed their beliefs, and they went even more into themselves. Their lives got that much smaller. So that was, as I say, where the inspiration came from. And then the other thing was the dawning realization that so many of the people we work with, for a range of reasons, are not digitally included, which is now a buzzword. Digital exclusion is the next big thing, I think. And it's particularly important, and it has been exposed during the lockdowns, simply because so many people who were used to getting health services, social services, and other things from the state were suddenly expected to turn to a digital platform to access their GP, to access their community mental health team, whatever it was. And they didn't have the kit, and they didn't have the internet service provider set up. Many of them didn't even have a smartphone. So they were completely lost at sea. So we surveyed the 300 and so people in Liverpool that we support and work alongside, and that came back really clearly. About a third of them were struggling. And of course, they couldn't get access to, those services, online shopping, quizzes, online pharmacies, all that stuff that probably you and I take for granted. So we sat down and we thought, what can we do about this? And that's when we came up with Building Up Stronger.
And Building Up Stronger, we'll talk about that. And it's really starting to kick in as we, unfortunately, head back into another national lockdown. And, I think that's one of the things that we don't know the answers to. We know the sort of short-term effects and the way that people felt. The medium-term effects, I think in many cases, seem to have been affected slightly differently because of the way we eased out of lockdown, to be able to get a full sense of where they're at before we can ever judge what the long-term effects are. But now we're going back into those lockdown situations again. I guess there'll be a lot of people who'll be thinking, oh no, here we go again. Aside from those who are thinking, oh, stress or anxiety has become a problem, those who have seriously mental ill health may well be going back to a place which is not a nice place to be, and a place they thought they'd got themselves away from.
Absolutely. Building Up Stronger the title itself was a reflection of what people were telling us. So you hear a lot, certainly in political circles, about building back better. But for a lot of the people we work with back then, before COVID, wasn't that great. So we didn't want to talk about building back better. We wanted to actually use people's own assets and the assets of the communities they live in to build them up and make them, if they could be stronger, to help them be more resilient to any second lockdown. We started the work back in July time to try and get some funding for it. And we're very lucky to get some relatively small amount, but still some really valuable amount from the National Lottery. Very much aimed at COVID resilience and COVID responses. So we started back at the beginning of October. We really hoped we'd have had a bit longer before we went back into another lockdown, because the aim was to work with people to develop what we're calling a bus plan. Because each person's situation is so different, whether you are one of the people that we're supporting in our services anyway, or whether you are someone in the community that's really beginning to struggle with your mental well-being. And we are already working at nearly full capacity with bus after only a month. We want to come up with something that meets your needs. This is not a one-size-fits-all offer. So what we do is actually come up with a bus plan, and the aim was to get that done before we went into a second lockdown, but hey-ho. And it is very much about saying to those people, how did you feel the first time around? What worked for you? What was the challenge? How are we going to do things differently going forward?
Tell me about digital exclusion and how things will play out the second time around. If people didn't have mobile phones and internet connections, has anything changed in the 6, 7, 8 months?
Not significantly. I mean, we'll only be scratching the surface. We have some small amount of kit that we've been gifted by other charities and other organisations. And if anybody listening does have any second-hand laptops, tablets, smartphones that can be reset so that they're wiped clean of any previous data, we will gratefully receive them, because what we do have is the ability to come alongside people and show them how easy it is to get on online, work with them to identify the cheapest ISP for them, work with them to identify a piece of kit that will work for them. Not everybody needs a whizzy laptop. For some people, a large smartphone's got to be as good. We've also worked over the summer to identify other ways of getting people online if you can't get an internet service provider. And very often people are very apprehensive about signing up for a long-term contract. So we've got other ways of getting people online, which involves sort of little boxes you can stick in your front room with a SIM card in that work as though you were on an internet service provider's hub. So we've got lots of solutions, and we've also got all of the information about what's available in your area, and we will walk people through as part of BUS getting online, and very often people find then they can get goods and services so much cheaper that the thing then pays for itself.
And such a huge difference that it's making. You know, most people will have had experience of that through lockdown number one, and whether it was the Zoom quizzes or being able to talk to your gran or your nan, just being able to get that connection, a lot of people did take for granted. But actually, for so many people, you know, a third of your users, just wasn't possible and hasn't been possible.
Yeah, absolutely. And if you're struggling to, which our service users aren't, but I know a lot of people across the city region will be dreading this lockdown because of things like the darker nights. They're going to have the heat on, the lights on. How are they going to entertain themselves? You know, can they feed their kids? Can they pay their bills? It may seem that affording to be online is a luxury, but absolutely it's not in this day and age.
It's such an important matter, and actually it's amazing, Margaret, how many times I've had conversations with different organisations that need to make connections with people in society who are vulnerable for various different means, and actually this comes up so often. There's a presumption they've got mobile phones, there's a presumption there's an internet connection, there's a presumption there's a laptop with keyboards, even presumptions that there's, you know, a working printer, you know, for printing off worksheets or homework or whatever it may be, and absolutely not always the case. Let's talk about building up stronger. How do people sort of respond when you discuss building up stronger? Do they see weaknesses in themselves? Do they recognise things that they want to improve about their own lives? How do you have that conversation without labelling somebody as being weak in the first place, potentially?
It's very much taken from without going into all the theory, a worldview that says that we've all got assets and talents and things to bring to the table, and it's very much based on having a conversation with an individual about what their assets and strengths are. And very often, if someone's had a number of knocks in life, because very often it's the external stuff that's happening to people that get them to a place where they're feeling that they can't respond anymore. They've run out of petrol. If they were a car, they'd be chugging along just before they crash. It isn't about saying you're weak. It is about saying, right, what is it you've got to bring to this table? Let's have a conversation. What are the things that are bothering you? Because very often when professionals go in to work with somebody or go to have a conversation with a family or whatever it is, they go in very much from a perspective of they know what it is that person wants. And we don't do that. We ask them what their priorities are. And some of the things that you might think you want to support someone to do might happen, but that might be a couple of months down the line when they've got to know you and you've built trust, because they don't know us from Adam. So we'll very much go in, relaxed. It will be actually over either the phone or on a digital platform at the moment, because the project was designed to work in digital spaces as well, because we feared we would have a second wave. And it is very much about being led by that individual to just come alongside them and sort out what the big issues are for them.
Give us a clue, give us a sense of the sort of things that you might not presume would be a requirement, or that, somebody else would say, well, you obviously need X, Y, or Z, and actually they're looking for A, B, or C.
Yeah. So very often it will be the small but significant things in their lives that they need help with. So some of that bigger stuff to people when they are becoming mentally distressed, when things are, their anxiety, they just don't know where to look, how to start to chunk that elephant up. It could be something as small. I've had an example in the past piece of work I did where there was a lady who was working with older people, and there was a lady that kept falling over. And she went to the local hospital for every test under the sun, every professional geriatrician, falls doctor, you name it, they saw her, and none of them could figure out what was going on. And it was actually one of the people from the charity I worked with then who got to know this lady for a completely different reason, nothing to do with the falls, who was able to get to know her well enough over a few weeks to realise the reason she wouldn't tell anybody what was causing the falls was because it was her little black dog, who had lots of toys around the house. This dog was the only meaningful relationship this lady had. She was quite socially isolated, and she couldn't see its toys because her eyesight was beginning to be less acute than it had been. And so she was falling over the toys or falling over the dog, and she feared if she told anybody what the problem was, they'd take the dog away, and that would have killed her. So we bought a long handle grabber and a big basket for the toys, and she was able to she couldn't bend before, pick up the toys, and she didn't fall again.
But isn't that a great example, Margaret, that actually we're not dealing with numbers and stats, we're dealing with human beings, aren't we?
Absolutely.
With human needs and all the pride that comes with being a human, and the emotions and and all of those sorts of things that come alongside. We're dealing with actual people as opposed to data and Excel spreadsheets and presuming you know what a person is about or what they need based on their age or their name or what part of a city they're from. And actually that's a really sort of human example, isn't it, of how getting to know these people might actually provide them the answers that they're looking for in a relatively inexpensive way, as opposed to, I don't know the cost of all of those hospital trips, but I've got a feeling a little hand grabber and a little basket was significantly cheaper and a lot more useful.
It was £32,000 for a fractured hip at that time. It's 10 years ago, so it's probably another few thousand on top now. That was the cost for the operation, time in hospital, and the rehabilitation to get someone back home.
Amazing. But actually, that's about that's about community response, isn't it? And getting to know people as human beings, which is what you've always tried to do at Imagine sort of Independence. I guess You guys have got to be quite strong-minded, though, if somebody's, asking for something which is not relevant or is not achievable or attainable. I guess you've got to offer them a sense of realism about what you can offer and what's manageable for them too.
Well, the great thing about Bus is that we're not trying to be the whole biscuit, if I can put it like that, because we're very good at doing stuff around mental illness and mental well-being and social inclusion for people who, have labels such as that. But what we're not the best at doing is knowing what, people need in other parts of the city, or older people necessarily need, or if it's something practical, there might be a solution that a local food bank or a local church, whatever, are better placed. So what we will be doing is saying to someone, right, we can do this bit, these other bits, we can recommend these organisations to you. So what Bus is actually about is helping to spin a web across the city centre. At the moment it's a pilot, so it's the 8 inner city wards in the city, and it's about pulling together all of those assets so that we can refer people on to those community organisations. But equally, if they want to refer people to us, we're available to them.
Now, here's a problem. It's a good problem for you to have, but I think it might potentially be a problem with it being a pilot scheme, which could be rolled out, wherever it's deemed fit. That, you talked about the web that's there. Now, in Liverpool, anyone who's listened to this programme over the years will know that web is so strong. The community organisations are there, left, right and centre, places to turn for people from right across society. And I don't know if that's the case everywhere else, Margaret. I don't know if every other city has got all of those connections in place. I think sometimes we take it for granted in Liverpool that those connections are already here. But are they in place in other places, in Manchester, in Leeds, in Birmingham, in Sheffield, in Glasgow, in Cardiff, in Exeter, in more rural places as well? Do you think it'll work?
I know it will. And I know those organisations are certainly there in the third sector and the community sector. I think the thing is, it's how you pull them together and how you enable or agree as a group of organisations to play to your strengths and not try to do everything yourself, because you get more bang for your buck that way. I think the other thing is not wanting people. I've heard organisations sometimes get described as sticky organisations, and so they do great work, but they do it with the same number of people, the same people week in, week out, and that might be okay in certain circumstances. But what we know at the moment, because of the impact of COVID-19 on people's mental well-being, is there is going to be a massive surge in demand. It's already starting, and I know from conversations with Merseycare that they are working out what their response is going to be for dealing with some of that increase in demand. They can't deal with it all, nor should they. So I think this approach is different in that it attempts to work in the gaps. It attempts to fill those gaps by bringing people together, and as I say, it attempts to encourage people to work where they fit best in that community. I think the other thing is, and it may be because I'm a proud Liverpudlian, and I would say this, wouldn't I? I think how we do it in the city is different. I always say about the NHS, sometimes it's absolutely brilliant at getting you physically better, but it leaves you feeling like rubbish because of how you're treated. And I think it's absolutely vital that we treat people with dignity and respect, and we don't make them feel awful because they're going through a period of difficulty, whether that's physical or mental health, or it could be because of they're becoming financially excluded for the first time because of COVID or whatever it is. We actually need to leave that person feeling better and going away from any service that we offer with their dignity and self-respect intact.
Absolutely. I'm sure if anyone from the NHS was here, they would say that's never their intention. But I think there does feel like a prevalence that the services that are on offer from someone like the NHS, it's about a diagnosis and then signposting to somebody. But actually, I think in terms of the conversations I've had, it would appear that in terms of people's wellness moving forward, it's often then the involvement of those third sector organisations, sometimes volunteers, charities that do some incredible work in 1,001 different fields, which actually then gives somebody a slightly different almost way of life. And I think that's the thing that then potentially puts somebody on a different path. And that NHS intervention may have been the point at which that path began, but actually the person who was guiding you through that may actually come from somebody who works in the arts, somebody who works in a cultural setting, or a sporting setting, or even like a knitting and natter group, or anything like that. And I think that's why working together is so important, isn't it? That those conversations take place, and everybody knows who the next person to pass the baton on to is, so that everyone can see where their journey is, and not that they're out on a limb potentially being dropped once funding gets cut or whatever it might be.
Absolutely, and we work very happily alongside the NHS. We've got really good partners in Merseycare, and that view of everybody has a place to play, a part to play, and how people do have a pathway, which again is a lovely NHS word, but that is clearly there in the city, and it's great when it works well. I think the other thing is that BUS, one of its great features is it's not the Model T Ford approach to a service, whether that's NHS or third sector. It is very much about building a prototype for each individual, and hopefully that is what's going to make it work.
In terms of referrals to BUS, Building Up Stronger, have people referred themselves? Have they been referred from partner organisations? How have they come on board?
It's been a mix. We've had people from well-known organisations. In Liverpool 8, it's great because that's where I'm from. Our first referral was from the Dingle, so I was highly delighted. It wasn't deliberate, but it was a genuine need for that person, but from all over, and people can self-refer, so there's no need to go in on a waiting list, go and see your GP, none of that. You can just get in touch via our website, either look up the number or email in. And again, we're receiving referrals in from partner organisations, and some of the big ones in the city were very well known: Everton in the Community, the Liverpool Foundation, Red Neighbours. We're working with all of those organisations, and some of the micro organisations at ground level. I mean, it is absolutely wonderful when you start mapping what's out there. The diversity of offers is amazing, and that's one of the challenges for people, is finding the right thing for them.
No, absolutely. And also that idea that if you don't find it straight away, that doesn't mean there's no help out for it. It just might be it's a different organisation or a different way forward. You mentioned the website. I'll mention it now: imagineindependence.org.uk. That's imagineindependence.org.uk. You can find out more about the Building Up Stronger project, and also Merseyside Mental Health Week. What else are your highlights for this week? What else are you looking forward to?
Well, we've got a sort of panel in the morning, which is setting the scene and sharing some of the learning from the first wave of COVID. So we're very lucky that we've got Joe Rafferty, the Chief Exec of Merseycare, on that panel. And as I said earlier, Andy Bell from the Centre for Mental Health, and one of my fellow women CEOs from a third sector organisation which has got such long roots in the city, from Nugent Care. Normandy Ragg will be talking about young people's mental health. And we've got another panel later in the week around social prescribing. We've got lots of radio and other TV interviews and coverage in the Echo, all of the normal channels and social media. And we've also got a big announcement, which by the time I think some of this goes out, we will have a new patron for the charity.
Excellent stuff. Well, you drop me an email as soon as you can tell me some more about that one.
I will. That's
stuff.
really exciting. I'll let you know who it is.
Now, I think it'd be remiss of us not to try and help you out with the issue we were touching on before, with the digital connections as well, because I think there will be plenty of people who are listening to this who are thinking, I think I've got an old iPhone or an old Samsung or an old tablet that's stuck in a drawer somewhere. If people are listening to this and have got those things, maybe they've got the charger, maybe they haven't, maybe they've got the box, maybe they haven't. What can they do with it? Is there somewhere they could come and drop them off, or let you know that they've got them and they could donate them so that you can get them to the people who need it?
Well, that would have been much simpler this time last week, Mick. But given that we're in lockdown and our office on Hope Street is closed at the moment, we will gratefully receive anything. We've just got to work out the logistics. But if people do have any kit, if they can hang on to it and email us, when we've worked out what a COVID secure way of collecting it is, we'd be more than happy to receive it.
I think it's one of those things which people will think, you know what, we're even going to have a pre-Christmas clear out. It's time for them all to go. And as you say, when they go into the hands of people who need it, suddenly life looks a little bit different, doesn't it, in terms of
absolutely
ordering things online shopping, those Zoom meetings that can take place, YouTube videos, podcasts, things that can actually point them in a different direction as well. And that can make a huge difference.
Yeah, and many of our social inclusion services, so Imagine runs social inclusion and employment advice services, as well as the supported housing that we do. And our team of amazing frontline workers in the supported houses have stayed in those houses, looking after people and being alongside them right from the very get-go of the COVID pandemic. So that's one group. The other group, the social inclusion people and the employment support workers, have put all of their services online. So not only will people be able to access the sort of social space where they can shop and watch TV and all of that, they would actually be then able to join in some of the sessions that we run, and we've got all sorts of things going on. And I know, for example, Mersey Care's life rooms have also moved online, and lots of other organisations have. So there is an awful lot out there if only we can get people online.
Absolutely, it's a really important thing, and we'll get up on social media as well that there's a need out there, and hopefully people will be able to respond, and then in a what's the phrase? In a socially distanced way, they can hand them over to you.
Absolutely.
With plenty of, I'm sure, antibacterial wipes and.
We've got those.
Maybe get some of the. Maybe they'll get the glitter grabber from the toy grabber from the lady. You could use that to hand the phones across. Yeah. Absolutely, we'll find a way of making it work, Margaret.
We will.
That's the important thing.
We'll have a talk to our environmental health friends over at Liverpool City Council. I'm sure they must have an idea. Maybe Bulky Bobs could get involved.
Absolutely. ImagineIndependence.org.uk. Margaret, thank you for taking some time out during Merseyside Mental Health Week to speak to us on the programme, and we wish you all the best with that. Building up stronger as well. Details on that website, imagineindependence.org.uk. Chief Exec of Imagine Independence, Margaret Hanson. Thanks for your time.
Thanks, Mick.
I hope you've enjoyed this week's podcast. Thanks for checking out Mental Health Monday. My name is Mick Coyle. You can find me on Twitter at Mr. Mick Coyle. You can also find me, Mick Coyle, on Facebook as well. Don't forget, if you want to speak to somebody about your mental health, you can do so. The Samaritans, free to call on 116 123. You can find mental health services where you are. Just look for the Hub of Hope. Type in your postcode. It'll find those mental health services close to you. And for support in a crisis, you can text SHOUT to 85258. That's if you're experiencing a personal crisis, you're unable to cope and need support. Shout to 85258. That's a text line. Do get involved in those services. In an absolute emergency, always remember the number to call is 999. Thanks for downloading the podcast this week. We'll be back next week with more Mental Health Monday.